Cardon Children's Medical Center, providing comprehensive pediatric care for Arizona's families.
Kids learn through play, so it is very natural for them to play and play out their feelings. And so with our medical play sessions, we can really, as a specialist, get a feel for how the kids are coping with being in the hospital, maybe some misconceptions that they may have going along with whatever's been done to them here. And so medical play, we just kind of allow a safe environment for the kids to come in and play with the equipment however that they want to. So Allison decided that her first doll immediately needed an IV. She also had an IV in her hand, and so that was at the forefront of her mind, what had happened to her. When she came into the playroom, she immediately picked that doll, started decorating it, said, "That's me." She pinpointed that this doll that her patient was going to be her, and immediately began to do everything to her patient that had been done to her. Almost every child who comes through our doors is going to get some sort of a blood draw or an IV. So that's the most common thing we see kids when they come in for medical play sessions, is that they want to do that. And most of them are very, open to using that real needle and poking their doll. And we hear a lot of dialogue that goes on, maybe something, that the nurse said to them about holding still, or, they will replay that exactly what happened to them, which is really neat. All these dolls are cloth and they're without faces, and that's exactly how we want them, because the kids can draw their own emotion onto the doll. And they are made by our community partner, Friendship Village. We've had a great partnership with them. They supply all of our dolls. It's very normal, it's very therapeutic. Most of the kids do choose their patient to be themselves. We know through research that kids learn better and play longer when there is an adult involved. And so when their parents are sitting with them, it gives them that one-on-one time with their child to sort of play through how they're feeling. And the kids don't realize that they're telling us a lot about how they're coping, but we sure do, as child life specialists, look at that, and then we can go back to the parent and let them know, any things that we see that they could be doing differently, or how to help their child cope with being here. But all of our parents get really involved with it, and they really enjoy having their child have this type of opportunity in the hospital setting. Child life specialists have been playing with kids and medical equipment for a long time, and I think it's something that all children in the hospital should have the opportunity to do, especially those that we can sort of see aren't coping as well, or may have some misconceptions about being here or what's been done to them. I would say it does. It helps heal their souls and how that they're feeling, and their psyche and just emotional well-being really does help with that. There's too many things about my job that I absolutely love, and it's just one of those jobs that you come to every day and can leave and know that you've made a big difference in the life of at least one child.